We have invested an awful lot of money, but got no results over the last few years. This time around, current budget, we put an extra £18 million into the budget. We were still not really seeing results. We have changed the management structure in children's services, and on the basis of that, pulled in consultants. I say consultants, we pulled in people, including some from DFE, all of whom are skilled at what they're doing. We have got a reshape of the cabinet, so I've got a cabinet member responsible for special education. And we focus completely, to the best of our abilities, on it, so that we can begin to do something about reducing the backlog of problems that we have there. We're also working in partnership, because this is a partnership effort. It's not just us, it's schools, it's health, and it's police. We're working much closer with them now. And all right, we still have some schools that we've got to work closer with, but we no longer run education in the way we did 20 years ago or 10 years ago. And we are working and we're getting a better relationship with our academies. And that is helping us also in supporting these young people.
Are you concerned, or what do you think when you hear stories of parents spending almost £2,000 of their own money to justify the help that they can then get for their child?
I think if people do that, they do it. I'm not being funny. I wouldn't wish to comment on that. What I will say is, yes, we have been slow at getting some of our youngsters assessed. We are getting better, but it's going to take us a while to catch up. It's a very high number of young children in Devon, or young people in Devon, that are actually being assessed on a yearly basis. And we will never really be able to get them done fast while there's a shortage of professionals to be able to do the job. And that's an NHS government problem. They are beginning to strengthen the specialists that are required. But while there's a shortage, it's not just Devon, it's a national issue of not being able to have the professionals that are required to be able to assess these young people.
Some of the campaigners and parents feel that council aren't really engaging with them. They've offered, for example, to have a roundtable meeting. They feel that their offers aren't being listened to. What would you say to parents that feel that their concerns aren't being heard?
I would say that we actually do have an organisation of parents that are very much listened to and worked with. And they are responsible for liaising with the parents themselves. I'm not sure whether parents are liaising with each other, and that's something that I have limited control on. But certainly we do have parents actually on the board working with the county council who represent the parents' setup, if I put it that way.
Is there a long-term plan for SEND? Is there a place we're trying to get to that we can demonstrate this is the target?
There has to be a long-term plan because we can't carry on as we are. And again, it's not Devon, it's national. Devon has got a heavy bill. Nationally, it's getting on for £3 billion. Everybody's got to get better at it. We have to get in earlier to support the children and the parents earlier, so that by the time the youngsters are kind of going into secondary school or even in times of primary school, they have got some wraparound support, which everybody is content with. At the present moment, we do not have that. And that's why we're having a large number of expensive cases coming to the county council where we are putting youngsters in residential accommodation, etc., that is expensive. And Devon's expensive, but again, if you listen around the country, some of the other local authorities have got bills much higher per pupil than we have. But we have to get to the bottom of this out. We've got to get in earlier. We've got to support earlier. We've got to work with our partners earlier in order to reduce the number of youngsters coming through the system. That is the secret of the whole damn thing. We cannot continue to expand the system as we are at the present moment because there isn't the money.